Hey everyone, and welcome back to Medical Terminology 1. This week, we're going to cover Chapter 3, the Musculoskeletal System. Let's get started. Lesson 3.1, Anatomy and Physiology of the Musculoskeletal System. In this section, we're going to learn to recognize and use terms related to the anatomy and physiology of the musculoskeletal system. Think of the chest cavity and how it provides a framework as well as protects the heart, lungs, esophagus, and trachea. The bones act as a type of bank for minerals. The body stores and makes withdrawals of minerals like calcium and phosphorus in the bones. The formation of blood is hematopoiesis, a function provided by bone marrow. Hemato is our word part for blood, and poiesis is the word part for formation. And as you can see from this list, we have several components that are going to make up the musculoskeletal system. And we also have some combining forms listed with each. So first we have bones, which could be osteo. Muscles give us word parts like musculo, myoso. Joints and articulation give us word parts such as arthro and articulo. Ligaments give us ligamento and syndesmo. Tendons give us word parts like tendono, tendo, and teno. Then we have fascia, gives us fascio. And finally cartilage, which gives us cartilago and chondro. Let's talk about some specialties and specialists. Some specialties include orthopedics, which ortho is our word part for straightening, rheumatology, and physiatry. Specialists include orthopedist or orthopod, rheumatologists, and physiatrists. The skeleton is divided into the axial skeleton and the appendicular skeleton. The division of the skeleton that forms the vertical axis of the body is the axial skeleton, shown here in beige. Free appendages, such as arm, legs, or other bones, and their attachments are called the appendicular skeleton, shown here in blue. This is definitely a portion you're going to want to remember, take notes, use flashcards. You will need to know the 5 bone shapes. So for the human bone shapes, we have a long bone, such as this image of the humerus. Then we have the short bone, like our carpals or the wrist bones. Then we have flat bones, such as our parietal on the skull. We have irregular bones, such as our vertebra. And then our sesamoid bones, such as the patella, which is also known as the kneecap. Let's discuss the bone structure a bit. So as you can see, I do have an image here of osteocytes. Cytes mean cell, osteo means bone, therefore osteocytes are bone cells. And we also have the matrix, osteoblasts. Remember, osteo means bone. Blast is the embryonic stage of development. If you notice, those cells look a little underdeveloped and quite simplistic in structure. Then we have osteoclast. Now, clast means to break down, and osteo again means bone. So osteoclast is kind of like a multinucleated bone cell, which absorbs bone tissue during growth and healing. In this image, you can see examples of compact bone, as well as cancellous or spongy bone. Then you'll also see in the middle, we have that medullary. This is actually pronounced medullary. I had a flub at the moment. Cavity, bone marrow. This word part would be myelo. Next, let's discuss long bone structure. So, some terminology that you're going to need to know is the diaphysis. The diaphysis is the long shaft portion. Dia means through or complete. Physis means growth. And the ends of the bones are called the epiphysis. The prefix epi means above, indicating that the structure is above the ends of the bone. The epiphyseal plate is the area where the bone growth normally occurs. Around age 16, the epiphyseal plates close and bone growth stops. Then we have the metaphysis. Meta means change, which is the area of both the epiphysis and the epiphyseal plate. Then we have the periosteum. Peri means surrounding. Then we have osteo, which means bone, and is our suffix for structure. The periosteum is the structure surrounding the bone, and the endosteum. Endo means within, which is the structure within the bone. Next, let's look at some examples of bone depressions. Any groove, opening, or hollow space is called a depression. Here you can see we have foramen. The plural is foramina, or the combining form is foramino. And you can see from this image I have below, right here is the foramen magnum. This is where your spinal cord and your brainstem are able to meet and interact. Then we have fossa, or fossae, or fosso is our combining form. In this image here, you can see several different fossa that's within our cranium. And finally, we have sinus. Plural is sinuses, and our combining forms are sinuso and sino. Then on the flip side, we have bone processes, which are raised or projected areas called processes. We have a few here that we can look at. So we have condyle, which gives us condylo. We have a crest, epicondyle, which gives us epicondylo, head, spine, or spino, trochanter, which would be trochantero, tubercle, which gives us tuberculo, and then we have tuberosity. Here you can see several raised processes off of a vertebral segment. So a little bit of review on the axial skeleton. Remember, this consists of the skull, the rib cage, and the vertebrae, shown here in blue. Next, let's discuss the skull, also known as the cranium, which gives us combining form cranio. So the skull is the cranial bone and is made up of the cranium and the facial bones. The cranium itself is made up of frontal bones, which form the anterior part of the skull, known as the forehead, the parietal bones, which form the sides of the skull. We also have the occipital bone, which forms the back of the skull. This bone contains the foramen magnum, which allows the brain communication with the spinal cord. Then we also have the temporal bones, which form the lower two sides of the cranium. The mastoid process is the posterior part of the temporal bone that is behind the ear. Then we have the ethmoid bone, which forms the roof and the walls of the nasal cavity. And then finally we have my personal favorite, the sphenoid bone, which is anterior to the temporal bones and is the basilar part of the occipital bone. Fun fact, the sphenoid bone is actually shaped like a bat. I'll put a picture in right here. Pretty cool, huh? Now let's talk about some of our facial bones. The zygomatic bones are the cheekbones. The lacrimal bones are paired bones at the corner of each eye that cradle the tear ducts. The maxilla is the upper jaw bone. The mandible is the lower jaw bone. Also, fun fact, it is the only movable bone in the skull. The vomer is the bone that forms the posterior and inferior part of the nasal septal wall between the nostrils. Then we have the palatine bones, which make up part of the roof of the mouth. And finally, we have the inferior nasal conchae, which makes up part of the interior of the nose. All right, let's review the rib cage a bit. So our combining form for ribs is costo. We will see that quite a bit. The ribs consist of 12 pairs of thin, flat bones attached to the thoracic vertebrae in the back and to the costochondral tissue in the front. There are 7 pairs of true ribs that are attached directly to the breastbone, which we know as the sternum, and there are 5 pairs of false ribs that are attached to the sternum by cartilage. There are also 2 floating ribs that are not attached in the front of the body at all. The medical term for the breastbone, again, is sternum. Note the xiphoid process on the tip of the sternum. I will show you with my mouse right here, this little point right here. Remember, this sounds like a Z sound even though it starts with an X. It's called a xiphoid process. Fun fact, when you're born, the xiphoid process is actually quite flexible and it ossifies, which means it turns into bone the older that we get. Usually it's completely bone by the time you're out of your adolescent stage. Let's talk about some vertebrae. So each bone in the spinal column is called a vertebra. Plural is vertebrae. The thin plates that protrude in the posterior fashion from the vertebrae is a spinous process. The ones that extend in the lateral direction are transverse processes. The arches between the transverse processes and the spinous process are termed the laminae. Now, a singular form of this would be lamina. The main part of the backbone is called the vertebral body. Let's talk a little bit more about these vertebrae. So we have 26. Now the first 7 are going to be our cervical. Now the first 2 have very specific names. C1, which is that top one, is called the atlas. And C2 is called the axis. This is the only part of the spine that actually turns and rotates. Then we have the thoracic region. That's T1 through T12. And then we have the lumbar, which is L1 through L5. The sacrum is S1 through S5. As we age, those 5 bones will actually fuse together. And then finally we have coccygeal, which gives us coccygo, which is the coccyx, also known as our tailbone. A good way to remember the different segments is breakfast, lunch, and dinner. So I know 7 might be a little early, but breakfast at 7, lunch at 12, dinner at 5. Maybe that'll help you remember your segments. Next, let's discuss the appendicular skeleton. The upper portion includes the shoulder girdle and the arms, and the lower portion includes the pelvic girdle and the legs. Let's go a little bit deeper in these upper appendicular bones. So we have the scapula, which you can see here is our shoulder blade, gives us combining form scapulo. Then we have clavicle, which gives us claviculo and clido. Then we have our humerus, which gives us humero. Radius and ulna, that gives us radio and ulno. Then we have carpus, which gives us carpo. Metacarpus, which gives us metacarpo. Remember, meta means beyond, so this is beyond the carpus. And then we have phalanges. Now this can apply to either your manual or your pedal. Those are manual phalanges are your fingers, pedal phalanges are your toes. Now let's review the lower appendicular skeleton a bit. That includes the pelvis, which gives us ilium, ischium, and the pubis. The bones in the pelvis are the ilium, the superior and the widest bone, and the ischium, which is the lower portion of the pelvis. This is the part that we sit on. And the pubis, which is the lower anterior bone of the pelvis. Note that the pelvis is instrumental in determining the sex of the skeleton. An angle of the bones at the pubis greater than 90 degrees usually indicates a female. But be careful. Don't confuse the ilium, I-L-I-U-M, with the ilium, I-L-E-U-M, meaning part of the digestive system. A good way to remember which is which is the ilium with the E has something to do with eating. The ilium with the I, that's part of the pelvis. In the leg, the thigh bone is the femur. The kneecap is the patella, the shin bone is the tibia, and the lower lateral leg bone is the fibula. Now, remember, the tibia is the stronger of the lower 2 bones. You can think of, I'd be fibbing if I said the fibula was the stronger of the 2 bones, because that's the tibia. The distal process of the tibia and the fibula are the medial and lateral malleoli, or malleolus for singular. The bones of the ankle are the tarsals, while the bones of the foot are the metatarsals. The heel bone is the calcaneus. As with the fingers, the bones of the toes are termed phalanges. Remember, these are pedal phalanges. Good way to remember that is that you pedal your bike with your feet. Joint or articulation are the areas of the body where 2 bones join. The range through which a joint can be moved is the range of motion, or ROM. Synarthroses, with our word part syn meaning together, means that they are joints that have no movement because they are joined. An example would be the joints between the bones of the cranium. Amphiarthroses gives us that word part amphi, which means both, which are joints that have limited motion, such as the vertebrae or the pubic bones. Then we have diarthroses, also called synovial joints, that are joints that have free movement. The prefix di means through, indicating that the joint is able to move through its range of motion freely. Examples are knees, shoulders, and ankles. Synovial joints have a joint capsule that encloses at the end of the bone, with a synovial membrane that lines the joint capsules and secretes fluid to lubricate the joint. Bursae are sacs of fluid that provide a cushioning function. Along with the cushioning that the bursae provides, articular cartilage covers and protects the ends of the bone. The meniscus is a crescent-shaped cartilage in the knee joint that additionally cushions the joint. Muscles can contract and relax. Skeletal muscle is voluntary in nature and striated in appearance. Smooth muscle is what the organs are composed of and is involuntary in nature. The heart muscle is unique in the fact that it is a hybrid. So it is a skeletal muscle in terms that it is a striated muscle in appearance, but it is involuntary like the smooth muscle of the organs. That enables the heart to keep beating without rest. Tendons are the bands of tissue that connect muscles to bones. These bands have an origin, where the bone is at the end of the attachment that does not move and is nearest to the trunk, and an insertion point, which is at the end of the bone that does move and is farthest from the trunk. Antagonistic muscles are those that work against each other in pairs in order to carry out movement. For example, one set of muscles must contract while the other set relaxes in order to flex or extend a limb. Then we have synergistic muscles, and those are muscles that work together to refine a movement. Next, let's take a little bit of a closer look at some of these muscles here. So as you can see, we have the trapezius. It's shaped kind of in a triangular shape. We have the deltoid, also triangular shape, caps the shoulder. Then we have the latissimus dorsi, which kind of looks like a corset of sorts around the back. Here's our triceps brachii. Then we have our gluteus medius, which is the middle-sized muscle of the gluteals, as well as the gluteus maximus. There is also a gluteus minimus. Back here we also have the adductor magnus, the gracilis. Then we have the hamstring group, the gastrocnemius, the soleus, and the Achilles tendon, which is also known as the calcaneal tendon, as it inserts and attaches to the calcaneus, which is the heel bone. Next, we're going to look at some of the anterior muscles. So here we have our frontalis, which is on the skull, temporalis, zygomaticus, masseter, and the buccinator, which is the cheek muscle, sternocleidomastoid, which goes right here. You also see where we have our pectoralis major, deltoid. You can also view this in your book if you would like to. We're going to talk about some more of these as we go. Quadricep group, tibialis anterior. Naming muscle conventions. Although we will not be able to identify and name all of the muscles in the body, you should be aware of the methods for naming them. For example, location is used to name the cheek muscle, the zygomaticus. The number of insertions are used to name the biceps brachii, which is the muscle that flexes the upper arm. Size is also used to name, such as the gluteus maximus, which is the large buttock muscle. The deltoid muscle is named for its shape, which is triangular. And the muscle action of the adductor longus is used to name the upper leg muscle that carries one leg back to the midline. And finally, take a look at the next slide to see how the origin and insertions are used to name a muscle. So here we have the sternocleidomastoid. We're going to talk about how the point of origin, which is the sternum and the clavicle, remember one of our word parts for clavicle was cleido, and our insertion point, which is the mastoid bone or the mastoid process. So that's why it's called the sternocleidomastoid. Now you might wonder why it's not called the mastoid sternocleido. Well, that is because this is our point of origin. This is the less movable part, the part of the trunk, and it inserts into the movable part, which is the mastoid process. Remember, we can move our head from side to side. We don't really turn our sternum. I hope that helps. Let's talk about some muscle actions. We'll begin with extension and flexion. Remember that muscle tissue has the unique properties of being able to contract and relax. When working in pairs, one set relaxes while the other contracts in order to pull limbs into a variety of positions. The action of extension is the process of stretching out or increasing the angle of a joint. Flexion is the process of decreasing the angle of the joint. Next, we have adduction and abduction. So, adduction means towards the midline of the body, and abduction means away from the midline of the body. An easy way to remember this is when you're absent from class, you are away from class. And adduction, you're thinking of like adding and subtracting. You're adding that to your midline. Next, we have supination and pronation. Supination is the process of turning the palm or medial side of the foot upward, and pronation is the process of turning the palm or medial side of the foot downward. Now, don't get these confused with supine and prone, which are a fixed position. Supination and pronation are an action. Next, we have dorsiflexion and plantar flexion. Dorsiflexion is the process of bending back, hence the term dorso. Plantar flexion is the action of lowering the foot and pointing the toes away from the shin, much like you would see a ballerina do. Next, we have eversion versus inversion. Eversion is the process of turning the body outward, while inversion is the process of turning the body inward. Then we have rotation and circumduction. Rotation is the process of a bone turning on its axis like a wheel. You can also think of rotation being your shoulder, how you can draw a perfect circle with your hand by moving it in a circular position. Then we have circumduction, which is a circular movement of the distal end of a limb around its point of attachment. So a good way to see this is to make a fist and draw a circle with your fist while keeping your arm stationary. It is turning on its own axis. Now let's look at protraction and retraction. Protraction includes pro, meaning forward, and tracto equals pulling. ION, like action, it's a process. So this is the process of forward pulling. It is the forward movement of a muscle, while retraction, meaning backwards, is the backward movement of a muscle. Lesson 3.2, Pathology of the Musculoskeletal System, learning outcome number 2. We're going to recognize and use terms related to the pathology of the musculoskeletal system. Quick quiz. What does path mean? We've learned that word part. Path means disease. Let's look at some terms as they're related to congenital conditions. Congenital can be thought of as Maybelline. Maybe she's born with it. Congenital means that they are born with it. We're going to be studying the pathology terms in groups. Our first group is congenital disorder, those that babies are born with. We're going to define achondroplasia and decode it. So, an order of the cartilage development. As we can see here, we have A, which means without. Chondro means cartilage, and plasia is development. So when we put this together, it would be development without cartilage. Then let's define muscular dystrophy and decode it. This is an inherent group of disorders that is a progressive atrophy of skeletal muscles. So first we have dys, this is our prefix meaning abnormal. Then we have tropho, which means development. And then finally we have Y, which I always say is a process. Something is usually happening when you see the Y. So this is the process of abnormal development. Now these first two terms have to do with the digits, fingers and toes. We have polydactyly. Poly means many or much, and dactylo means fingers or toes. And then that Y ending again is a process. So this is a condition of more than 5 fingers or toes on each hand or foot. Then you'll notice we have syndactyly. Syn means joined or together, and is a condition of the joining of fingers or toes, giving them a webbed appearance. Next, we'll move on to spina bifida occulta. Bi meaning two, fida meaning split, and occulta meaning hidden. This is a congenital malformation of the bony spinal canal without involvement of the spinal cord. Then we have talipes, which is a deformity that results in an abnormal twisting of the foot. It is commonly called clubfoot, and in rare occasions can be acquired. Remember, the pronunciation for this is talipes. And finally, we have torticollis, which is a prolonged congenital or acquired condition that manifests itself as a contraction of the muscles of the neck, causing the head to turn to the side. It is also called wryneck. Let's look at some terms related to bone disease. So first we have osteodynia. Dynia is our suffix for pain. This is the term for bone pain. Then we have osteitis deformans, which is a term for misshapen bone as a result of inflammation. The eponym for this term is Paget's disease. Next we have osteomalacia. Malacia is our suffix for softening. It is a softening of the bone, and this is usually caused by a loss of minerals in the bony matrix as a result of vitamin D deficiency. If this disorder occurs in childhood, it is called rickets. Then we have osteomyelitis, which is an inflammation of the bone and the bone marrow. Finally, osteoporosis, which is the loss of bone mass. Poro means passages, or as you can kind of imagine, pores, right? Which results in the bone being fragile and at risk for fractures. A lesser condition is osteopenia. Penia is our suffix for deficiency, where there is a loss of bone mass, but it is not as severe as osteoporosis. Now we'll look at terms related to chondropathies. So first we have chondromalacia, which is a softening of the cartilage. Remember, chondro is our word part for cartilage. Malacia is our suffix for softening. Then we have costochondritis, which is an inflammation of the cartilage of the ribs. Remember, costo is our word part for ribs. Now let's look at some terms related to arthropathies and related disorders. First we have a bunion, which is common, painful enlargement and inflammation of the first metatarsal phalangeal joint, which is at the base of the great toe. The word bunion comes from the Greek word that means turnip. Then we have carpal tunnel syndrome, also known as CTS. It is a comprehension injury that manifests itself as fluctuating pain, numbness, and paresthesias, which is an abnormal sensation like prickling of the hands caused by the compression of the median nerve at the wrist. Then we have TMJ, or temporomandibular joint disorder, which is the dysfunctional joint between the lower jaw bone and the temporal bone of the skull. It may be accompanied by gnathalgia, which is pain of the jaw. Gnatho is our word part for jaw. Next we have osteoarthritis, which is a joint disease that is characterized by degenerative articular cartilage and a wearing down of the edge of the bone at the joint. A synonym for osteoarthritis is degenerative joint disease. This is also the most common form of arthritis, as it is due to normal wear and tear on the body. Then we have rheumatoid arthritis, which is an autoimmune inflammatory joint disease that usually occurs in a much younger population, 20 to 45, than osteoarthritis. And rounding up the arthropathies and related disorders, we have arthrosis, which is any abnormal condition of a joint. Osis, meaning abnormal condition, unless it's with a blood word part. Osis means abnormal increase, but here it's just an abnormal condition. Specific types of arthroses are hemarthrosis. Remember, hemo means blood, and an abnormal condition of blood in a joint. We also have hydroarthrosis, which hydro means water or fluid, and is an abnormal condition of fluid in the joint. And pyarthrosis, which pyo is our word part for pus. So this is an abnormal condition of pus in a joint. Then we have a Baker cyst, which is a small sac or cyst which is filled with synovial fluid in the popliteal area of the leg, which is the back of the knee. It is often associated with rheumatoid arthritis. Then we have bursitis, which is the inflammation of the bursa. It may be caused by an overuse of a joint. Then we have crepitus, which is the crackling sound that may be heard in joints. If anyone's ever gotten up and they swear they hear Rice Krispies with the snap, crackle, and pop, that's known as crepitation and is a normal part of the body. Then we have osteophytosis. Phyto means growth and is an abnormal condition of bony growths in a joint. Herbidinodes are osteophytes of the interphalangeal joints in rheumatoid arthritis. Then we have scleroderma. Sclero means hard and is a connective tissue disorder that causes hardening and thickening of the skin. Systemic lupus erythematosus. Erythemato is our word part for red, and is a chronic systemic disorder characterized by a distinctive butterfly rash on the nose and cheeks. Finally, we have tendinitis, which is an inflammation of a tendon. Now let's look at some terms related to deforming dorsopathies and spondylopathies. Dorsalgia is a term that is used to describe upper back pain. Remember, dorso means back and algia means pain. Then we have lumbago, which is used to describe lower back pain. Lumbar, lumbo, combining form lumbo means lumbar, and suffix ago means disease. Sometimes the normal slight curvatures of the spine are exaggerated and cause pain or dysfunction for a patient. Hence, each of these terms for malcurvatures ends in the suffix osis for an abnormal condition. First, we can see we have scoliosis. Scolio means curvature, is a lateral S curve of the spine. This condition can literally cause an individual to lose inches in height. Then we have lordosis. Lordo means sway back. It is an exaggerated anterior curve of the lumbar vertebrae. So, hence the term sway back. A way that I remember this is me and the Lord go sway back. It might be a little silly, but it helps me remember what lordo means. And finally, we have kyphosis. Kypho means round back and is an extreme posterior curvature of the thoracic area of the spine, which is the upper portion. Someone you might know that had kyphosis would be the Hunchback of Notre Dame. So, humpback is also another term used for kyphosis. I have had students in the past who have used that H in kyphosis to help them remember humpback. Maybe it'll help you. Now we'll talk about ankylosing spondylitis. Ankylo is our word part for stiffening. And this is a chronic inflammatory disease of idiopathic, which means it's unknown origin, which causes a fusion of the spine. A herniated vertebral disc is a protrusion of the central part of the disc that lies between the vertebrae, resulting in compression of the nerve root and pain. Then we have spondylolithiasis. Lithiasis is slipping. So this is a condition resulting from the partial forward dislocation of one vertebra over another. Then we have spinal stenosis. Stenosis is an abnormal condition of narrowing. It is a painful condition of narrowing of the spinal canal that may be caused by osteoarthritis or spondylolithiasis. Spondylosis is an abnormal condition characterized by stiffening of the joints between the vertebrae. Now let's look at some terms related to muscle disorders. A contracture is a chronic fixation of a joint inflection. This is caused by atrophy and shortening of the muscle fibers after a long period of disuse. Then we have fibromyalgia. Fibro means fiber, myo means muscle, and algia is our suffix for pain, which is a disorder that is characterized by musculoskeletal pain, fatigue, muscle stiffness, and spasms, as well as sleep disturbances. Then we have myasthenia gravis. Remember, myo means muscle, a means without or no, and sthenia, which is a condition of strength, gravis means severe. It is usually a serious condition that is characterized by fatigue and progressive muscle weakness, especially of the face and throat. Plantar fasciitis is an inflammation of the fascia on the bottom of the foot. The fascia is the covering of the muscles. Then we have polymyositis. Poly means many, myo means muscle, and itis means inflammation, which is a chronic idiopathic inflammation of several voluntary muscles. Then we have post-laminectomy syndrome. Post meaning after, lamino means lamina, and ectomy is that surgical removal. So this is a group of symptoms that occur together after the removal of a lamina to correct a spinal disorder. Then we have rhabdomyolysis. Rhabdomyo means striated muscle. Lysis means to break down or destruction. So this is the breakdown of striated skeletal muscle. Now let's review some terms as they're related to trauma. So trauma pathology is divided into these categories. We have fractures, strains and sprains, and dislocations and subluxations. Closed fractures, also called simple fractures, are those in which the bone is broken but the skin remains intact. An open fracture, also called a compound fracture, are those in which the bone is broken with one or both ends piercing the skin. Then we have pathological fracture, which is one that results from an underlying disease, such as osteoporosis or cancer. A synonym is spontaneous fracture. Then we have comminuted fractures. Those are in which the bone is crushed and or shattered into multiple pieces. A compression fracture is one which the bone collapses on itself. A Colles fracture occurs at the distal end of the radius at the epiphysis. It usually occurs as a result of bracing oneself for a fall. Then finally we have a complicated fracture, which is one where the bone is broken at one or both ends and then pierces an internal organ. An example would be a broken rib that then pierces the lung or the heart. Some more fractures. An impacted fracture is one in which the ends of the broken bones are driven into each other. A hairline fracture is a minor fracture, appearing as a thin line on an X-ray. This type of fracture may or may not extend through the bone. Then we have a green stick fracture, which is one where the bone is partially bent and partially broken. It is relatively common in children because of their bones that are still somewhat soft. Then we have a Salter-Harris fracture, which occurs at the epiphyseal plate in children. There are also some other fracture types, such as a spiral fracture, oblique fracture, and a transverse. Now let's discuss the difference between a sprain and a strain. A sprain is a traumatic injury to a joint that involves the ligaments. The severity of a sprain is measured in grades. Then we have a strain, which is a lesser injury that involves the overuse or overstretching of a muscle or a tendon. So a sprain is related to a ligament, whereas a strain is related to a tendon. Then we have dislocation. Dislocation occurs when a bone is completely out of its place in a joint. If it is a partial dislocation, it is termed a subluxation. Then we have compartment syndrome, which is a potentially serious medical condition that is the result of swelling within the fascia. The increased pressure of the swelling limits blood supply and can lead to nerve and muscle damage. Now let's discuss some terms related to benign neoplasms. Remember, benign means non-cancerous. An exostosis, ex meaning out, and osteo meaning bone, osis again meaning abnormal condition, is an abnormal outgrowth of a bone. Synonyms are hyperostosis and osteochondroma. An osteoma is a benign tumor of bone, oma being our suffix for tumor. A chondroma is a benign tumor of the cartilage. Remember, chondro means cartilage, that usually occurs in children or adolescents. Then we have a leiomyoma, which is a smooth muscle tumor. The most common type occurs in the uterus with the common name of fibroid. Then we have a rhabdomyoma, which is a benign tumor of striated muscle. Remember that striated muscle is the same as skeletal or voluntary muscle. Now we're going to talk about terms related to malignant neoplasms. Malignant means cancerous. So note that each of these four cancers has the suffix sarcoma. This means that it is a connective tissue malignancy. So first we have osteosarcoma, which is a malignant bone tumor, which also refers to as Ewing sarcoma. This is the most common children's bone cancer. Then we have chondrosarcoma, which is a malignancy of the cartilage. Remember, chondro means cartilage. This particular tumor is most often found in adults. Then we have leiomyosarcoma, which is a malignant tumor of the smooth muscle of the body. This is most commonly found in the uterus. And then rhabdomyosarcoma is the cancer of the skeletal or striated muscle. Synonyms are rhabdosarcoma and rhabdomyoblastoma. Now, with most things health-related, age matters. So some pediatric terms that you might see more often are going to be congenital disorders or traumas. Geriatric terms, on the other hand, you may see a lot of are osteoarthritis, osteoporosis, fractures, and cancer. Lesson 3.3, Diagnostic Procedures and Therapeutic Interventions for the Musculoskeletal System. Learning Outcome 3. We're going to recognize and use terms related to the diagnostic procedures for the musculoskeletal system. Learning Outcome number 4. We'll recognize and use terms related to the therapeutic interventions for the musculoskeletal system. Let's discuss some terms relating to imaging. There are a variety of techniques for seeing inside the body. Arthrography, remember arthro means joint, graphy is that process of recording, is an X-ray recording of a joint. Arthroscopy, again, arthro means joint, scopy is the process of viewing. This is a visual examination of a joint that is done through the use of an instrument called an arthroscope. Remember, arthro is joint, scope is the instrument to view. Then we have computed tomography scan, which we commonly know as a CT scan, which is an imaging technology that records horizontal slices, which we know are transverse planes, of the body for diagnostic purposes. Next, we're going to talk about DEXA scans, which stands for Dual Energy X-ray Absorptiometry, a procedure that measures the density of bone, especially at the hip and the spine. Other names for this procedure are a bone mineral density study and the abbreviation DXA. DEXA is an acronym that is pronounced DEXA. Next, we have electromyography. Electro means electricity, myo is muscle, and graphy, again, is a process of recording. This is the procedure that records the electrical activity of the muscles. The abbreviation is the EMG. Then we have MRI, which is magnetic resonance imaging. And it is a procedure that uses the magnetic properties of cells to record detailed information about internal structures. Then we have a myelogram, or myelo means spinal cord. Engram is a record or a recording, and it is an image of the spinal canal after the injection of contrast medium. Finally, we have an X-ray, which is also called a radiograph, and it is an imaging technique that uses electromagnetic radiation for recording and internal structures. Let's look at some terms related to other diagnostic tests. So first we have a Phelan test, which is used to diagnose carpal tunnel syndrome. The backs of the patient's hands are pressed together to elicit the symptoms of the disorder. A rheumatoid factor test is a laboratory test that examines the blood for rheumatoid factor, or the RF factor, a substance present in the blood of individuals with rheumatoid arthritis. Then we have the serum calcium. Serum calcium is a test to measure the amount of calcium in the blood. Then we have the range of motion testing, or the ROM testing, which is an assessment of the degree in which a joint can be extended or flexed. And finally, we have goniometry, which is the process of measuring a joint's range of motion. Now let's look at some terms related to setting fractures. In order for a broken bone to heal, it usually needs attention. A fracture that does not mend and realign correctly is termed as a malunion, mal meaning bad. If the fracture does not heal at all, it is termed as a non-union. Sometimes pieces of bone are broken off when the fracture occurs. These pieces of bone will not have a blood supply and will die. Each fragment is then referred to as a sequestrum. The preparation for setting a fracture requires cleaning the site of the wound and removing any foreign bodies or debris. The process of doing this is called debridement. Once alignment of the ends of the fracture is accomplished, a method of holding them in place until they heal is necessary. If the bones are stabilized without the need for any opening of the skin, it is termed external fixation, or EF. If an incision is necessary for the bones to be held in place by pins, screws, or plates, it is termed as internal fixation, or IF. The alignment and mobilization of the ends of a broken bone is called a reduction. An open reduction requires incision of the skin, meaning we are opening the patient up so that we can see the bone in order to perform the reduction. Closed reduction does not require any incision. The patient's skin layer is completely closed. Let's look at some terms related to therapeutic interventions. So here we have amputation, which is the removal of a limb when there are no feasible options to save it. An artificial body is part of that constructed to replace the missing limbs, eyes, or other body parts called prosthesis. The plural form is prostheses. Now let's review some terms related to therapeutic interventions. So removal of a bunion is a bunionectomy. Remember, ectomy is our suffix for surgical removal. Osteoclasis is the refracturing of a bone. Osteo means bone, classis, intentional breaking. This may be necessary if a malunion has occurred. Then we have osteoplasty, which is surgical repair of a bone. Remember, plasty is our suffix for surgical repair. Then finally we have traction. This is the process of pulling a body part into correct alignment, as in the correction of a dislocation. Here we have kyphoplasty, and it is a minimally invasive procedure designed to address the pain of fractured vertebrae resulting from osteoporosis or cancer. Remember, kypho is our word part for round back, as in kyphosis. That may be caused by loss of bone mass. A balloon is used to inflate the area of the fracture, and a cement-like substance is injected. Next we have laminectomy, which is used to remove part of the bony arches of one or more vertebrae to relieve compression of the spinal cord. Finally, we have spondylocentesis. Spondylo is our word part, or our combining form, for vertebra, and syn is our word part for together, and our suffix desis means binding. This is a fixation of an unstable segment of the spine through the use of spinal traction, a body cast, or stabilization with a bone graft or synthetic device. Synonyms are spinal fusion and spondylodesis. Here we have arthrocentesis, which is a surgical puncture of a joint to remove fluid. This may be done for therapeutic or diagnostic purposes. Centesis is a suffix meaning surgical puncture. Then we have arthrodesis, which is a binding or stabilization of a joint by operative means. Desis is a suffix meaning binding. Then we have arthroplasty, which is surgical repair of a joint. Plasty is our suffix meaning surgical repair. Then we have meniscusectomy, which is the removal of a meniscus in the joint. The usual site of a meniscus removal is the knee. Then we have syndesmoplasty, which is the surgical repair of a ligament. Then we have tenomyoplasty, which is the surgical repair of a tendon and a muscle. Teno is a combining form for a tendon, and myo is a combining form for muscle. Many of us have heard of these in our geriatric patients. So here we have a total hip replacement, which is the replacement of a patient's natural femoral head and the acetabulum of the hip with either plastic or metal appliances. Then we also have a total knee replacement, which involves the replacement of the entire knee joint, either unilaterally, meaning on one side, or bilaterally, both sides. Finally, let's cover some pharmacology. So here we have analgesics. An is our prefix meaning no, not without. And then we have analgesic, which means pertaining to without pain. These are drugs that are used to reduce pain. Examples include morphine, hydrocodone. Then we have anti-inflammatories, and these are used to reduce inflammation and pain. Examples include steroidal or non-steroidal anti-inflammatory drugs known as NSAIDs. Then we have antirheumatics, which manage symptoms of rheumatoid arthritis. Bisphosphonates affect bone formation to treat diseases such as osteoporosis, Paget disease, or bone cancer. Then we have disease-modifying antirheumatic drugs, or DMARDs as they're called. They slow the progression of rheumatoid arthritis by also reducing signs and symptoms. Muscle relaxants relieve pain caused by muscle spasms by relaxing the skeletal muscles. All right, guys, that's all I've got for you today. I hope you enjoyed. Let us know if you have any questions. Until next time, have a good one.